And when it comes to guidelines, less than 10% of doctors are discussing lung cancer screenings with their patients. The American Lung Association says these screenings can reduce lung cancer deaths by 20%. So what's going on here? Let's bring in America Tonight medical contributor, Dr. Omer Awan. Dr. Awan, it's great to see you. So give us the reasons here. Why are people skipping out on these?
I think there's so much ambiguity with respect to lung cancer screening, and quite frankly, not many people even know that there's a test for lung cancer screening. When we consider, everyone is very comfortable getting mammograms for breast cancer. Everyone is comfortable getting colonoscopies for colon cancer. 70 to 75% of people who are eligible are getting that, but less than 20% of people who are eligible for lung cancer screening are getting a low dose CT. And not many people know that a low dose CT scan of the chest is the screening test for lung cancer. And coupled with that, and a problem with that also is that even if you know that a low dose CT is the test of choice for lung cancer screening, not many know who's eligible, and it's somewhat unclear who really is eligible. And really, the eligibility is really three criteria. You have to be between 50 and 80 years of age. You have to have a 20 pack year smoking history, and you either have to be currently smoking or you've quit within the last 15 years. And that 20 pack year smoking history is confusing because what does that really mean? So what it means is that it means you've been smoking one pack a day on average for 20 years. It could also mean smoking 2 packs a day on average for 10 years. Both of those would be a 20-year smoking history.
Okay, that's great. Thank you for spelling that out. So one of the things that you discuss is that some doctors just skip this advice, advising people to get this screening. So why would they do that?
Well, it's a problem, and I think part of the reason is that some doctors may honestly not even know that this is a screening test. And that sounds silly, but in reality, that's the case because it's not as well publicized, I think, as other major screening tests like mammograms for breast cancer, and even a pap smear for cervical cancer or something like that. So I think where doctors even are missing out on an enormous opportunity to educate patients about lung cancer when we consider that less than 10% of primary care physicians are talking about this with their patients. And this is concerning because lung cancer is the deadliest cancer of all cancers. And most lung cancers get diagnosed at a really late stage when it's too late. It's too hard to save a person, or it's too hard to institute treatments that will then be effective. So this onus also is on doctors, physicians. I'm calling out physicians that they also need to speak more clearly, better, and more efficiently with their patients and advocate for this important screening test.
Okay, so there are some potential adverse side effects from these screenings. Is that part of this conversation at all?
I don't really believe it is, Maritza. I think, yes, absolutely, there are some risks, but those risks are minimal. When we talk about risks, we're talking about things like false positive tests, things that, saying that there's a lung cancer when in fact there's not. That rate is about 10 to 13%, so maybe 1 in 10 cases. Overdiagnosis would be another potential limitation where, we identify a cancer, but it would not have harmed the patient. So, the cancer is identified, but the patient is subjected to treatments that then would potentially harm the patient. So overdiagnosis is an issue. And then also we look at radiation, but really the amount of radiation that you're getting from a low dose CT is minimal. We're talking about 1 to 4 millisieverts of radiation. That's the same amount of radiation that you and I get just walking outside for about 6 months, natural radiation. So, very unlikely to induce cancer. We talk about cancer-induced or radiation-induced cancers. That happens from very prolonged forms of radiation, not what you would see from getting a low-dose CT scan or any other imaging test.
Okay, so Dr. Awan, we know that smokers are at a greater risk of developing lung cancer, but a lot of people think, well, I never smoked, it's not a concern. So why is that train of thought wrong? I know that maybe that doesn't mean they're eligible for this screening, but why should people still be aware of this?
Well, there are other risk factors, right? Smoking for sure is the number one risk factor for lung cancer. 80 to 90% of lung cancers are associated with smoking, but radon exposure would be another one. Secondhand smoke is another big one, right? So even if you're not smoking, if you're around others that do smoke, you are still at risk of getting lung cancer, unfortunately. That's the reality, right? And that number is growing. Like the amount of people that get lung cancer from secondhand smoke, from radon exposure, or pollution in the air. These are known causes for lung cancer. So none of us potentially are safe, but certainly smoking would be no doubt the number one and the dominant risk factor for lung cancer.
Okay, let's pivot a little bit here, Dr. Awan, and hopefully I can get through this. This is your last appearance on America Tonight as the show prepares for its last day on Friday. And I want to say, on behalf of the whole team, thank you so much for all you've contributed here.
Thank you so much, Maritza. Honestly, it's been an honor. I'm gonna miss this. I'm gonna miss doing this every Wednesday night. It's been a real treat for me to talk about public health and hopefully help some viewers. And honestly, I mean, talking about you, Maritza, you've done this with such compassion, such grace, and that's rare for an anchor. And I think you should be commended. I mean, there's so many people to thank. I mean, Ileana, I absolutely love her. Chelsea Cosby, Gary Friedman, who I've worked with, Lisa Cohen. The list goes on and on. I mean, the people at Scripps. I think what people don't understand, the viewers, is that the people at Scripps are so unbelievable and so incredible, and some of the nicest people that I've ever met. So, from the bottom of my heart, thank you for giving me this opportunity.
We just thank you so much, and thank you for those words. And you are right. The people here are what make this place so great. Contributor Dr. Omer Awan, thank you, sir. We will be in touch. Absolutely.